Today is January 14th, 2021. I'm with Dr. Shaun Thompson, who is Medical Director at Valley View Villa Long-Term Care Facility in Fort Morgan, Colorado. And this is a re-interview, so this should be interesting. So I'll ask you again for the record this time. How you doing?
I'm doing okay, doing all right. We had an outbreak since the first visit. I think we had not had any cases, and then we had an outbreak starting end of November through through much of December, I guess.
Mm-hmm.
So that was an interesting experience.
Interesting. My kids used to say that meant you'd ate it. Actually, they were cruder than that, but that's okay.
Not one I would want to repeat for sure.
Well, not for posterity, not to be recorded. So tell me about that. Like, how many cases did you have? How did it come in?
So we were doing routine scheduled testing, I think twice a week at that point, just surveillance testing. And so we had a day where we had maybe 3 cases. I think on a Thursday or Friday we got results. And then on a Sunday we got like 15 positive cases all at once. And so, yeah, it was a crazy day. And so once the residents turned positive, they were moved to an isolation unit. And so initially, one to a room, and everything was sort of walled off.
Okay, so you had 15 cases that showed up within a week. Were they staff and residents?
These were all just residents. We did have, through all of this, a large number of staff too, but that, I was just talking about residents, just patients that tested positive. So we had 15 in one day, and 3 or 4 a few days before that, and then several that trickled in over the next few weeks. Some we tested because of symptoms. Some were just the surveillance testing turned up positive.
Mm-hmm.
So I had heard, I'd kind of been following some of the other long-term care docs and their experiences. Another doc in Colorado had said in the outbreaks he'd been through, he'd seen about 30% of the people get really sick and even die pretty quickly. Maybe a third didn't have any symptoms at all, and then a third kind of in the middle with some, mild to moderate symptoms. And that was pretty consistent with my experience. What we saw, we had one gal within, was asymptomatic, and then within 6 hours kind of went downhill and passed away. And then some people, almost no symptoms, and everything in between.
So how many did you wind up losing all together?
It's hard to say. I think about a half dozen that I attributed directly to COVID that, weren't. Mm-hmm. It's hard in the nursing home because, a lot of people are, as are declining and going downhill anyway. So I think there were probably another 6 or so that died in that period that COVID probably sort of pushed them towards the door. They were walking out anyway, but I think COVID kind of pushed them. So I don't know exact numbers, but I think around a dozen or so in that time that passed away, in a month or so.
And how many residents do you have?
So the census. Go ahead.
No, that's it. That's my question. Like, how many residents are there usually at the home?
So normally we're around 70, and we had at one point everybody. I think we had maybe 5 residents that did not get COVID. So 95% of people had it, either just a positive test or got sick. And yeah, about a dozen deaths. And then the difficult thing for the nursing home is that through none of this time could we take new admits, and so now our census is about half of normal because of attrition and because of no admits coming in. We just now started taking new admits, but overall census is about half of what it normally would be.
Well, I could see a marketing angle here. Come to Valley View, we've got herd immunity. You know, if 95% of the people got the infection, wow. And then how many, in the meantime, so you had, at one point, it's if 95% of the people were positive and 2/3 of them were sick to really sick with the infection, that's a whole lot of people. And did you have staff out during that time too?
We did have some staff out, and so they ended up, all the managers ended up going on like 12-hour shifts, and they would alternate 3 days on, 3 days off, and day shifts and night shifts to try to cover all that. And the director of nurses, you know, basically lived in the building. I think she was there 20 hours a day, it seemed like, sleeping in her office. And because the other difficulty was that everybody who was positive then was isolated. So we have a whole separate kind of, they put up these plastic entryways that would lock off the isolation. And so you couldn't share staff between the positive COVID unit and the negative unit. And so it really limited the number of people that could be in that positive isolation unit.
Did you
So
have
yeah,
any
it was,
PPE?
we did, yeah. And we would do in the positive rooms, N95 mask, surgical mask, face shield, disposable gown, and gloves, and would change in between each. Even if there were 2 people in a room, we would change between each patient interaction. But yeah, I don't know of any problems obtaining PPE through any of that.
And it sounds like a horrible strain. How did the staff hold up?
Yeah, I think pretty stressful on the people that, you know, were still coming in, and we're just, you know, for that month or so, just stretched to the limit, I think, for sure.
Mm-hmm.
Yeah, I know our activities director, it was really hard on her, as you know, I think the nurses and myself, as sort of the clinical people, you kind of expect, you know, you signed up for that kind of care, critical illness and death and dying and that kind of stuff. But I think it hit, you know, some of the sort of non-clinical, like activities director and the dietitian and medical records and the business office, and, you know, those kind of people are still coming in and trying to fill gaps and pass meal trays and do those kinds of things. But seeing that number of people, you know, sick and dying was a big strain, especially on the sort of non-clinical people.
Was there any attempt, and this is a really a naive question, it's certainly not leading, was there any attempt for those non-clinical people to help them through this? Was there anything organized to kind of say, hey, you didn't sign up for this, you know, here's how we clinical people look at this stuff, or here's what helps us deal with it? Was it, even if it was informal, did something go on with them?
I'm not aware of anything formal. I think, you know, in some ways it felt like everybody was sort of in the same boat. And so I think there was a lot of, you know, we'll get through this side by side kind of thing. Mm-hmm. And you know, I would try to send out little messages, you know, keep, you're important, and the work you're doing is important and needed, and, you know, some sort of mini inspirational kind of messages. But I think most of that was sort of informal.
Mhm. Have you lost staff? People who've quit? People who are even going to just change careers?
I think so. Yeah. I know. In fact, just before I got on this call, the activities director I was talking about had resigned for exactly that reason. She just couldn't deal with the emotional part of it. But I just found out that she decided not to, so that's good news.
Mhm.
Um, but I think I, as much maybe the clinical part, I think more because of the hours. Now, since we're through it and on the other side, sort of our census is so low that it's hard to get enough hours, and so it's sort of the opposite problem. And I think we're losing, some staff because of that as well. And there's so many different opinions as far as testing and vaccinations and those kinds of things. I think I guess I don't know this for sure, but I wonder if we've lost some people, because of that, because they don't want to put up with all the PPE and the screening and the testing and that kind of stuff
Mhm.
too.
And I and I know this from having worked in rural healthcare for a long time myself. It's not like you have a huge reservoir of people from whom to hire. Where are you going to replacing that staff? I'm sure is a challenge.
Yeah, for sure. I think the CNA level, they sort of rotate between the three nursing homes in the county. They get upset with one and move to another and sort of rotate around. So, but it's kind of the same pool of people, and the nursing pool is even smaller. A lot of the nursing hours have been former employees that moved that are friends with the DON and came back to fill in some hours, just out of the goodness of their heart. They're doing hospital PRN work or whatever. That there's a couple of people I know that's the case with that did agree to kind of come back and fill in just because there was so many holes in the schedule. But
And
yeah, in the more specialty, we lost our social services gal. I don't know if that's the same. I don't know all the reasons for her leaving, but yeah, replacing those kind of people is really tough because there's no pool of people waiting for those specially trained jobs.
yeah. Um, did you of your patients who were sick? Uh, did any of them go to the hospital, or did you care for them all where you were?
We had a few that went to the hospital. If um, I tried to have a conversation with every family once we diagnosed somebody when they were COVID positive about goals of care, and most people we try to steer towards treating in place. But there's a few people that were full code and wanted full treatment, and if they got sick, we sent them out. Um, so I know one lady that got sent out, ended up on a ventilator, got transferred out of town, was on a ventilator and ended up passing away. Um, but most people we treated in house, and most people, if they got sick, we sort of just transitioned to comfort care, just
Mhm.
focused on making sure they were as comfortable as possible.
And I assume you still use like dexamethasone and oxygen and
Yep. Yeah, I had a handful of people we put on, if they needed oxygen, then that puts them in that severe category, and I put them on dexamethasone, and yeah, oxygen and just the supportive care. We didn't do anything beyond that. It was interesting. The people, so I ended up putting a few people just on IV fluids because they
Mhm.
stopped eating and stopped drinking. But that was like 2 weeks later from
Mhm.
their positive test. I kind of had to shift my mindset because, like, influenza,
Mhm.
they get sick and you do a test and they have the influenza, and then you're dealing with symptoms right away. With this, the timeline for me was kind of shifted because we were testing a lot of times even before they developed symptoms,
Right.
or very early on. And so we didn't start to see the symptoms for a lot of them for 2 weeks later. And so they would come off of isolation and go back to their old room.
Mhm.
And I had to change my mindset, because in my mind, I'm thinking, oh, they're off of isolation. They must be doing better now. But then they actually did worse, because they stopped eating and drinking and got dehydrated and weak. And so I had a handful of people we'd put on IV fluid to try to get them through that. And had one lady, had a 105-year-old lady
Hmm.
that got it and was in that kind of category. She wasn't that sick initially, got off of isolation, went back to her old room, and just would not eat or drink, and ended up, I put her on IV fluids for a couple of days, and she did a little bit better. And then we took her IV out, and she still couldn't keep up. So we ended up sending her to the hospital, where she got IVs, and they corrected her sodium. And she came back and has still struggled. She actually went home with her family this week, but that was interesting, that something I hadn't experienced, and there was kind of a delay to it that I didn't expect.
And for your patients who did survive, have you seen what sequelae have you seen? Yeah, I assume some have recovered fully, but what I'm sure there's a range too of complications or.
Mostly just weak, and yeah, lost weight. A lot of people lost weight, and just because they haven't been eating and drinking. I don't know if I didn't hear a lot of the loss of taste or smell, but I think it's just loss of appetite, and just not feeling up to it. So a lot of people with weight loss, and bed rest, they couldn't get out of bed, so they get weak and puny. Just that debility and frailty, that was the big thing. And still have a few people kind of trying to bounce back from that, a month later.
Mhm. So it's January 14th, and you said this went on till the end of all through December. So you're not very far past it yourself, right?
Right.
And how are you doing?
Mostly.
Well, go ahead.
Mostly, through December. We were pretty much done kind of by Christmas, New Year's, in that week. And now it feels like we're through it now. A few people still not, kind of down on appetite and strength, but for the most part, recovering. And we're starting to we can have families come in, do some visits, I think, next week, and lightening up some of the restrictions and stuff a little bit. So there's a little bit of hope now. Plus the vaccine, I think, provides a little bit of hope too, that hopefully we won't have this big of an outbreak in the future.
Have you had the vaccine at your facility yet?
Yes. Yep. So our second vaccine clinic will be next week. So we're about 2.5 weeks out from first vaccine.
Oh, that's great.
Yeah.
Moderna?
Yes. I'm not sure.
Yeah.
I actually think it was Pfizer, but I'd have to double check.
Okay. So that's so how have you held up through all of this, and how are you doing now? Go ahead.
Yeah. Physically did not get sick, and I haven't tested positive through any of this, so thank goodness for all of that. Mentally it was okay. I feel like, kind of like I said before, this is part of what I knew I would get into, and not in these numbers or in this density, at this time. But I'm not uncomfortable, I guess, dealing with death and dying terribly, and so it was okay. Not easy, but not something I would want to go through again. But I felt like I held up okay.
Yeah, but then you get home and have to isolate at home.
Yeah. So my wife, she had a previous exposure, and so she had sort to set up another bedroom, and so she went back to that bedroom. So yeah, there were this 3 or 4 week period where yeah, I would come in and go to our bedroom and change my clothes and shower, and we would maybe pass once in a while in the kitchen, or text each other, "Hi, I'm home," kind of thing. But yeah, definitely was separated, and my son was home at that time too, and so I separated from him as well.
Yeah. Even even people who aren't on the front lines, um, I'll speak for myself. Even I'm just getting just weary. Um, I I don't wonder. I imagine that a good deal of the explanation for this huge surge we've been experiencing in the last month is that there are so many people who are just so weary of isolating, and they're back out there and just saying, "Let the chips fall where they may. I don't want to live like this." How's that been among? I mean, it doesn't sound like you're getting out and among the townsfolk, but what do you find kind of is going on, the general attitude around there in Fort Morgan? What are you hearing? How do people feel?
I have that same sense. I think it's just we're done with doing the isolation and the mask and that kind of thing, and let's just. I almost feel like it's. I don't know. I think they're still kind of worried and concerned about it because nothing's changed. But I think, yeah, just tired of doing that. Let's just move on and be done with it. Sort of out of sight, out of mind, or out of mind, out of sight. I guess would be the opposite.
Mm-hmm.
That's my sense too. I think in the nursing home and the work, it's become the new normal, and so it's now routine. You feel we switched from N95 masks to surgical masks, and it felt weird to just be in a surgical mask instead of the more restrictive N95 mask, because that had become, the routine, and the face shields are now routine, and so you feel naked without it. I haven't noticed that type of fatigue sort of in the work setting, but I guess
Yeah.
among more lay people, I think that's true.
Have you gotten out and about, or besides solo bike rides or horseback? Have you been out and about in town at all, or?
Not really. We took my son back to Tacoma, Washington to college. And so that was, the most time I've spent outside of the house or the nursing home in quite a while. And that's been about the only sort of out there I've done.
Mm-hmm.
And I was impressed with the number of masks and the separation, and I don't know Tacoma very well, but I was telling my wife it seemed like kind of a ghost town. They had some light displays up, that we kind of walked a downtown trail to look at those, and it was a weeknight, but there were very few people around, or walking traffic, or even car traffic. So they seemed to still be kind of isolated from what I could tell.
It's that way here too. Downtown Chicago is like a ghost town.
Even now.
Yeah.
Oh,
It seems so strange.
yeah.
How about professional support? Once again, you're on your own. You have your own practice at the nursing home. I forget, is the nursing home affiliated with a larger organization?
It's a life care
Okay, it's a life care.
building. Yeah.
So,
Life Care Centers of America.
okay, so do you get some support from them then? Professional support?
Yeah, there's we still do a weekly call, with he's sort of a volunteer medical director, I guess. He constantly reminds us he doesn't have any authority, but he does a weekly call, and he keeps up really well with the latest developments and treatments and vaccines, and talks about that, and then just sort of checks in with anybody who wants to be on that call. It's a volunteer, so that's a nice thing to have. It's a weekly thing I do.
And Life Care's a pretty big, they have a lot of homes, don't they? A lot of facilities.
Yeah, 230 some across the country.
So this
yeah,
is a
it's a
national
big
meeting?
corporation for sure.
It's a national meeting and they have just a volunteer, like a volunteer medical director? They don't have a full-time, official position on the air, on the letterhead kind of?
His status is a little bit unclear to me. In the past, we've had, a real medical director, and then this Dr. Evans was sort of I forget what, he was like a consultant kind of position, and there've been some changes, and the medical director left, and the physician program kind of shrunk a little bit. And so I think he's a paid consultant. He's not an official.
Mhm.
He doesn't serve in a supervisory capacity, I guess, is what I meant to say as far as medical director.
So
He's
as
more
far
of
as
a medical consultant, I guess.
so as far as physician practice goes, they're not they're not saying, here are the rules you have to follow. Here's the way you have to treat people. Here's who you have to send to the hospital. They're leaving it pretty much up to you, right?
Yeah. Now there's a lot of corporate policy and procedures and guidelines that they develop with the health department, and a lot of cooperation with the local health department too. They were called on every, people going back and forth to the isolation unit, and the PPE required and the testing required, and all that type of stuff came through corporate policies and through the health department, which was really nice. We didn't have to keep track of all that. It's nice to have those guidelines were pretty set, like here's how you do it.
Mhm. And
but I know that was a big onus.
that's the Northeast Health Department?
Right.
Oh, that's really good, because that's really close to home.
Right. Yeah. There was a lot of connection with the local county health department.
Mhm.
I think on a one-on-one basis more than the state health department. I think probably, on the corporate level, they were more at the state health department level, but locally, yeah, there was a lot of communication with the local health department, which was nice. Yeah. She was always available.
Now, when I was in solo practice, the hardest thing about it, I mean, there was a lot I loved about it, including being able to make the decisions. But being solo was hard. Not having somebody down the hall to say, "Hey, let me run this by you." Do you have a professional support system of just colleagues, buddies, people who you're connected to through this, who've been able to you've been able to support each other?
Yeah, I have a couple of them. One is through Life Care. There's like I say, the doctor program has shrunk a little bit, but there's a doc has buildings he lives in Salida.
Mhm.
So he's had nursing homes in Salida and Canyon City and now Alamosa. He was the one that had been through, he's been through an outbreak at each one of those buildings ahead of me. And so I talked to him a time or two, and that was really helpful. And he's been on these weekly calls, so that's been helpful. And then locally through the residencies, we have our rural training track that I'm a community faculty, I guess. And so the residents and the other, faculty locally and in Denver are a source, if I have questions or need support or second opinions or curbsides or whatever, I call them. And also our local internist too. I talk with her in Manchester. I don't know if you know her quite a bit.
Yeah. That's good. So you have a net of colleagues. I've thought, having been involved with rural training tracks, the best thing about it is that it breaks down the isolation that we rural docs are so subject to, the sense of isolation, that you have colleagues, you have connection.
Yeah, I've noticed that more in the nursing home because there aren't a lot of doctors that do full-time nursing home, and
Mhm.
I'm the only doc in my building. And so for somebody else to know or to understand sort of those limitations or what that setting is like, there's not a lot of people that get that.
So speaking of which, what do you do how do you work it out when you're gone, when you take vacation or whatever? Does somebody come in and substitute for you?
Yeah, there's a semi-retired doc that she used to be in Arizona, and she's semi-retired and moved to Colorado, and she does vacation coverage. So
Okay.
she's the only doctor that comes in. So I have to coordinate my vacations with her availability. So she covers Colorado as well as Hawaii is in our region, and so she goes and will cover a few weeks or even a month at a time in Hawaii in a building. So that's challenging because there's nobody local. I think they may take some phone coverage, but
Mhm.
when the idea is to treat people in place, that's less than ideal. So that call is a challenge, and if we lose this one doctor, I don't know what I'm going to do.
So it sounds like you're still okay with the career you're doing, in spite of all of this, and in spite of having to do it on your own and all of that.
Yeah, it's been it's a good fit for me. It's a good pace and a good. It's just been a good fit. Yeah, I'm happy where I'm at.
Yeah, that's great. All right, so what else should we talk about? Oh, telehealth. Are you doing any of that?
I did a few FaceTime kind of visits initially on the outbreak, and then when I had an exposure and was trying to prevent, face-to-face interaction. So I've done a handful of them, but not a ton. For the most part, I've been in the building. But
Mhm.
that's the my own fear, I guess, of doing those has broken down, and a lot of those barriers. That's a lot easier to do and bill for, I guess,
Mhm.
too. I think there's been
Right.
changes in the reimbursement for telehealth visits have broken down a lot of those barriers.
Yeah, I mean,
So and I don't think
telehealth.
that's going away.
We were always doing
Yeah,
an
on the phone.
hour or so of telehealth on the phone every day, and it was unreimbursed. So
Right.
that's good. But so say what your fears were of telehealth that have broken down, aside from not getting paid. Where your resistance came from.
Just I think just not being able to connect with the person and read those sort of subtle cues, and especially in the nursing home, the communication is so hard anyway. A
Mhm.
lot of people have hearing impairment and vision impairment, and some degree of cognitive or impairment or dementia, and so all of it's hard to talk to them even in person, and then to throw a computer in there.
Mhm.
It certainly was not ideal even now, but is workable. They need a support person, a nurse or somebody with
Mhm.
them to kind of work things usually, but wasn't as bad as I had thought. And you can still, we've been doing the applicant interviews for the residency applicants. We
Mhm.
did all through Zoom this interview season, and a lot of them I talked about, like, do you still get a feel for the program even though you're not
Mhm.
physically in the clinic and in the town and seeing it, and you can, and they've all said for the most part you get a feel for the person and the people and the relationships, and you can kind of do that. It's not 100% the same, but I think you do. I've you get more of that than I thought you would have.
How about during isolation, video visits between patients and families? Have they been doing that?
Yeah, they've been trying to. There's been some of that. In the in the the COVID positive unit, they would have to put the computer in plastic, in a bag or something for infection control, and so that was an even bigger challenge because then you have the crinkles and it's not clear. But even apart from that, there have been computer visits with families, and that's been kind of a lifesaver. I think I think as much or more for the families than the patients, because you can call and get the update from the nurse about how your mom's doing,
Mhm.
but nothing substitutes for actually seeing her,
Of course.
seeing her face. Um, so, so that made a big. I think that was reassuring for a lot of families.
So when this is all over, when the viral dust has settled, how do you think our world's going to be different? We'll just talk about the world of healthcare. There's going to be more done remotely, but what else?
Um, I don't know. I think people will appreciate more the things that we took for granted before, the in-person visits and the activities, and just being able to come and go as you please and not have to have your face covered and wear a gown. I think those, just that appreciation, I think, at least me personally, I'll try not to take those things for granted anymore, because you don't realize, how important those things are.
Mhm.
Yeah, I think the remote visits, especially for um, the nursing home patient to see a specialist without having to leave the building or leave their room, that's a big deal. Even to go 2 blocks to the hospital is a big deal. And if they can do more of that remotely, I think that's great. And I think we'll have that.
It's been so interesting how much these interviews have changed from the first to the second.
Is that right?
Oh, yes. Being at a different place in this pandemic. The first ones we did, you were the first one, I think, weren't you? And that was in March.
First or second, yeah.
Yeah. So um, the what we've been through in this amount of time, people have changed a lot. Um, Facial expressions have changed a lot. Everybody's kind of more sober and subdued. Um, and we'll see. I mean, maybe we'll even do a third interview sometime when it's all over. Anyway, I hope I see you again, and it doesn't have to do with a pandemic. But
Right.
yeah, okay.